May I request Dr. Sonia Trikha, Director General Health Services, Department of Health and Family Welfare, Government of Haryana, to share her points of view on what kind of innovation being done in the state of Haryana. Over. Yes, you can come here. And we also have a recorded video of Dr. Rathan Kelkar. He is the Chief Executive Officer of State Health Agency of Government of Kerala. So we can play this video after all the speakers present here speak their mind. Thank you so much. Over to you, ma'am.
Thank you. Good morning, everyone. Thank you, APAC Network, for giving me this opportunity. So on behalf of Haryana government, I'm just going to briefly touch upon a few initiatives that Haryana has taken, which are state-specific, and some which, as part of Government of India's bigger, scheme of things, Haryana is also doing. So the first state-specific initiative that I'm going to talk about is called e-Upchar, which is the Hospital Management Information System. We did hear in the earlier session about the importance of digitalization, about the importance of having electronic health records, about having a better queue management system, about, increasing efficiency, because healthcare sector is highly energy intensive. It requires lots of human resource, lots of money, lots of energy, and generally energy, not just electricity, but also energy everywhere. e-Upchar, very, very briefly, it touches each process that happens inside the hospital. So from the moment that a patient makes his or her entry into the hospital till the time this patient walks out of the hospital or gets discharged, every process is digitalized. So this initiative was launched way back in 2014, which made Haryana a very progressive state at that point in time, because ABDM is still recent and many states are yet to take it up. So we started with all the government medical colleges, all the district hospitals, some of our CHCs and some of the PHCs. So we just wanted to have a snapshot of CHCs and PHCs, but we wanted to cover all the bigger hospitals. So when I say that it captures all the processes, so starting with the registration, where someone touched earlier in the earlier session, that it has to be very smooth, very efficient, so that people don't have to queue up much before the hospital opens and then go back without getting seen by the doctors. So made things, the queues simpler at the time of registration. And then we started measuring time, which we still do, that what is the waiting time outside each OPD. So queue management, for better queue management, a token system was introduced outside each of the specialties. Then to see whether doctors were available or not, there is an admin module. So the principal medical officer or the medical superintendent doesn't have to come out of his cabin to see which doctor is there and what time did the OPD start, because all of this he can see from his screen. So for the patient, after the patient is seen by the doctor and a provisional diagnosis according to the International Classification of Disease, we were using 10, the ICD-10 classification. After that is done, the patient would either go to the pharmacy to take medicines or would probably go to radiology to get an X-ray or to a lab to get some blood work done. So all of those processes are also captured. And the good thing is that all our lab equipment and the X-ray machines are integrated. So the doctor doesn't have to wait for the lab results to actually be handed over in a written format or a manual format. But if you press the patient's UHID, you would be able to see the X-ray through the PAC system or see the lab result. The critical values displayed, the doctor consulted, so like this. And another beauty of the system which we found, which actually saved a lot of our human resource and a lot of confusion which usually used to be there in the hospital, was the indenting and distribution. So in a ward, typically what happens is if a nurse needs, anything, like it could be linen, it could be gloves, it could be drugs. So she had to actually first write on a piece of paper and send a ward boy to 4 different locations. And this ward boy would come back probably after 4 hours without those things which she needed. But here now everything being, electronic and being kind of available on a touch of a screen. The store officer, the CSSD man, the linen distributor person can see on his screen which ward needs what, and nobody physically needs to go. So very briefly, just saying that what did it all lead to? It led to, as I mentioned, we are able to use the human resource better. So for example, in a lab, because no manual reports are being handed out, no dispatching needs to be done, the same lab technician can work on improving quality. So can now see QA, the external quality assurance and do better quality, QC, that we say quality control, or plot the LJ charts and work towards improving quality, which otherwise no one was finding time for. We have to remember that public health system is different from private health because we have lots of patient inflow. Similarly, the ward boy was now available to take care of the patients in the wards. We were also able to save a lot of money because we didn't need to print hard films, for example. So with a lot of change management, because initially, okay, let me also talk about the resistance and the obstacles that came along the way, because a doctor, as the Honorable Minister of Uttarakhand was mentioning, that there are like lots of patients. So outside every OPD, there could be 200 patients. And as he mentioned, that after 40, maybe it's not possible for a doctor to pay that much of attention. And now we were burdening this doctor with also putting something on the computer, type something. So there was a lot of resistance. We had to have more people. But when they started seeing the advantages at the back end, because now they didn't have to prepare a discharge slip. Someone mentioned that it takes a long time discharging a patient because everything was now available. You just had to kind of print out because the processes inside the ward were captured, all the lab results were there. So there were advantages. This was about EUCHAR. The other thing that I'm sure you've all heard about from different state partners is telemedicine. And actually before COVID, all of this started, but COVID gave it a big boost. Most of us, I'm sure most of you also might have consulted doctors using telemedicine those days because it wasn't possible either due to lockdown or due to the scare of acquiring COVID for us to go to a hospital. And I'm so happy to say that Haryana, even though we were a little late in kind of going full-fledged, but approximately 3 lakh patients have availed the service of telemedicine. And it is actually made easier and possible through having health and wellness centers because people are now able to access healthcare close to their households, close to their homes, in villages, in urban slums. And it's easier for the doctor who's an MBBS to get expert advice from a specialist and also for the patient to talk to a specialist sitting very far away and not travel long distances just to be able to get the same advice. So this was about some initiators since, I don't have the luxury of time. Another thing that I wanted to briefly touch upon is use of AI. Just 2 brief examples that I want to quote, which Haryana has used. We tried through different pilots. So one was, in one district G of Haryana, we started using AI tools to detect tuberculosis. So this is basically complementing the usual test X-rays. And another good thing which has happened over the years is, using technology everywhere. So in our mobile medical vans, for example, we have labs and we also have handheld cameras, which, each district has a few. So when patients or, you have some hotspots and people are not coming forward, it's actually better for then the health service to go to those patients. And we do that. We send our mobile medical vans. Lab is there, but X-ray was not there on the mobile medical van. So now we started using the handheld cameras, which were integrated with an AI tool, so that we were able to detect, a possible case of tuberculosis, and then refer patients to a, microscopy center or a place where better detection or a confirmatory test was available. Another AI, example that comes to my mind is of diabetic retinopathy, and that this had to be actually fully packed. So all pieces of the puzzle had to be put together. So we actually started with a course which Public Health Foundation of India had kind of proposed 6 years ago, or maybe more, when I was director of State Institute of Health and Family Welfare. So we did this course for our medical officers for them to be able to diagnose, detect, and treat diabetes in a much better manner. But we didn't have, this other thing that I'm going to briefly touch upon, which is basically to detect complications of diabetes, retinopathy being one of them. So taking images of patient's retina and then predicting if this patient is likely to develop retinopathy in near future or if the patient already has retinopathy was a big, I would say, big help for us to send these patients to PGI Chandigarh, with whom we had actually, with PGI Chandigarh Department of the Ophthalmology, we had partnered for these patients to now avail service of lasers so that they don't turn blind. So these are two things which Haryana experimented with. Of course, there's so much under the sun. You all know. I just heard one of my partners, Dr. Anil, who's sitting here in his new avatar, because he used to be a partner with us as part of the system integrator which ran eUpchar, and he mentioned that now taking picture of a woman's cervix is going to predict or maybe going to tell us about early onset of cervical cancer or cervical cancer already there, so that the patient can avail service. So similarly, like so many things, using hip x-rays to detect if the patient is likely to have fractures in the near future or in the near future, and kind of warn the patient to be more careful is another example that comes to my mind. There's another thing that one civil surgeon from District Ambala was mentioning. We do have a lot of problem of absenteeism. Public health has its own challenges. Whatever biometric thing you may put, people may still not be there. So somebody was mentioning that now with one tool that they are kind of enforcing all doctors, an application actually, an app, for the doctors to have or the other staff to have in one district. Now they're able to know for how long did the doctor or the A&M or the staff nurse work in the facility where she's posted. So there's so much scope, so many things. I think with this, I would just conclude my brief talk that I wanted to share with you. All the very best, and thank you again for giving me this opportunity. Thank you.
So if I can beg leave, I have a meeting to attend.
Okay, sure.
It's a ministry meeting for Asian Games.
Okay, sure.
So as a member of the All India Sports Council, my presence is must.
Okay,
So I just leave here. Please excuse me. Thank you for this opportunity. And so much talk about digitalization.
Before you leave, I'll
yes.
then ensure that you get a small token of appreciation from us.
I will. But
I request Sangamitra Mon to come on stage and hand over.
Just want to make an appeal
Dr.
to all
Deepa
of you.
Malik.
I know there is so much talk about artificial intelligence, digitalization, using mechanical support, but I make an appeal. There is nothing that can replace a doctor's smile. A pat on the shoulder of the patient gives the maximum reassurance. A hug from a nursing assistant or a nurse who comes in the morning to take your blood pressure while you are still on the ventilator, it, I think, is the most important thing is human interaction in this profession. So do not give up on that. Use the machines, use the digitalization, use the AI to assist you to deliver a bigger smile to people like us. Thank you.
Okay. So I request Sangamitra Mohanty to kindly hand over a small token of appreciation to Dr. Deepa Malik, Padma, Shri, Khel, Ratna, Arjuna, Awardee. Thank you so much. And I have been told that Dr. Sonia Trikha also has to leave. Dr. Sonia Trikha also have to leave. So Sangamitra ji, if you can hand over Sangamitra ji. Sangamitra, I will request if you can hand over this to Dr. Sonia also. She's also leaving. I request Sangamitra Mohanty to hand over this to Dr. Sonia Trikha. She has to leave. And then we carry on with the session. Huge round of applause for Dr. Sonia Trikha, also Director General, Health Services from the state of Haryana. With this, I request Professor Ajai Singh, Executive Director and CEO, AIIMS Bhopal. Okay, we're having a photo and then thank you so much.